Thank you very much for the opportunity to present our recent findings from a systematic review that we conducted to look at the different outcome measures that have been used in clinical trials of abdominal massage in adults with chronic constipation. My name is Pauline Campbell, and these are the affiliations that I need to disclose as part of this presentation. Chronic constipation is a common symptom-based condition. Adults living with constipation may present with a variety of different complaints, including infrequent bowel movements, the sense of feeling bloated, and general discomfort. Chronic constipation is thought to affect as many as 1 in 7 adults, but it disproportionately affects older adults and other vulnerable groups. The frontline treatment usually consists of laxatives, although this is not always successful at alleviating constipation, and guidelines to treat constipation in adults are currently lacking. Some clinicians and patients have chosen to use a more alternative, conservative, non-invasive approach to help relieve the signs and symptoms of constipation, which has led to a number of different techniques, abdominal massage techniques, being described in the literature. Abdominal massage is practiced in a variety of different clinical settings, including palliative care, oncology, and hospice environments. Spinal cord injury patients also frequently use abdominal massage as part of their daily bowel self-management program. Abdominal massage involves asking a patient or a participant to lie on their back while the provider manually manipulates and strokes and kneads the abdomen. Each session typically lasts between 15 to 20 minutes in length. We don't completely understand how abdominal massage works, but it's thought that the massage itself stimulates peristalsis in the gut, and that initiates a bowel sensation and reduces colonic transit time. Furthermore, the actual physical kneading itself of the massage may result in a softening of the stool consistency and allows the stool to pass more easily. So why is it important to do the systematic review at this time? At the moment, we have no idea which outcome is best to capture any potential benefit of this particular intervention. Clinical investigators are designing clinical trials in this field, and they need to be able to make the right choice of outcome tool early on. Researchers working in the field need to be able to pull data and bring that information together to determine whether abdominal massage is effective or not. So they need some standardization in how it's reported and measured. Clinicians and patients need an outcome tool that is real world and actually reflects something that is meaningful and relevant to them. So in this review, we sought to bring that information together. We used standardized and well-established Cochrane techniques to conduct the systematic review, and a protocol is available and published online at the Cochrane library. This table shows you our selection criteria that were applied, and we included randomized controlled trials and quasi-controlled trials of adults. We conducted systematic searches of major electronic databases, and this search is current up to November 2020. Each included study was assessed using the Cochrane risk of tool bias, and the data was brought together by calculating the frequency of each outcome and each outcome measure tool that was reported within each included study. Our systematic searches identified almost 2,000 records. Of these, 14 studies or 18 randomized paired comparisons were included. This represents a total of 981 participants from a very diverse group of clinical populations, which included individuals with complex needs who were living in residential care, adults with a variety of neurological conditions, for example MS, stroke, and Parkinson's. The interventions that were described across the different studies were typically delivered daily in a single session, which lasted 15 to 20 minutes. Each trial was ranged from 2 to 8 weeks, with a mean duration of 4 to 8 weeks. for 0.8 weeks, Abdominal massage was delivered by a range of different providers, including physios, nurses, and experienced therapists. The methodological quality of the included studies was generally judged as high quality or low risk of bias, as you can see in this figure here. The exception to this was the performance bias, as it wasn't possible to blind participants or staff to the intervention that was being delivered. A total of 95 outcomes were reported across 14 trials, and a large number of validated and non-validated tools, often capturing the same outcome, were reported within each study. The most frequently reported outcomes were the severity of constipation in 8 studies, which was measured using 5 different instruments, and the type of stool, which was also reported in 8 studies using 3 different tools. Adverse events were the least frequently reported outcome, and outcomes were measured at baseline and immediately post-intervention, so very short-term follow-up, but there were very little in terms of medium or longer-term follow-up. The outcomes described in these clinical studies that compared the effectiveness of abdominal massage were highly varied. They often reported overlapping outcomes of different aspects of constipation severity and symptoms within the same trial, using different validated and non-validated tools. Although a number of these instruments are very similar, their scoring system is very different. So, moreover, trialists often presented data in a variety of ways, which limits our ability to compare and pull the data. When you consider this alongside the diverse populations in the studies, it dilutes the value of conducting these often high-quality trials. Thank you for your time.